What are the differences between ionizing and non-ionizing radiation, and how do their interactions with matter vary? Answer: ionizing radiation includes high-energy particles such as X-rays and gamma rays capable of removing tightly bound electrons from atoms, thereby creating ions. This process can lead to biological damage at the cellular and molecular levels. Non-ionizing radiation, on the other hand, includes lower energy forms such as ultrasound and MRI. It does not carry enough energy to ionize atoms, but can cause molecular vibrations and heat. Interactions with matter. Ionizing radiation primarily interacts through three mechanisms. Photoelectric effect. A photon is completely absorbed and its energy is used to eject an electron from an atom, creating a vacancy. Compton scattering. A photon collides with an outer shell electron, transferring part of its energy and continuing on with reduced energy while the electron is ejected. Pair production. At energies above 1.22 MeV, a photon can convert into an electron-positron pair near a nucleus. Non-ionizing radiation interacts differently, often causing excitation of atoms rather than ionization. For instance, in MRI, radio frequency waves excite hydrogen nuclei, causing them to emit signals used to form images. Describe the biological effects of radiation and differentiate between acute and chronic effects. Answer: biological effects of radiation can be classified into acute and chronic effects. Acute effects. These occur shortly after high doses of radiation exposure and can manifest as radiation sickness. Symptoms may include nausea, vomiting, fatigue, and hair loss, depending on the dose. Acute effects are typically stochastic, meaning they increase in probability with increasing dose but do not have a threshold. Chronic effects. These occur after prolonged exposure to lower doses and may result in long-term health issues, including cancer and genetic mutations. Chronic exposure can lead to deterministic effects, which have a threshold dose below which the effect does not occur. Chronic effects may take years to develop and are influenced by factors like dose, rate, and individual susceptibility. Explain the ALARA principle and its importance in radiological practices. Answer: the ALARA is low as reasonably achievable principle is a safety principle designed to minimize radiation exposure to patients, staff, and the public. It emphasizes the need for practitioners to implement all reasonable measures to keep radiation exposure to the lowest possible levels, considering economic and social factors. Key aspects of ALARA include justification. Ensure that any exposure to radiation is justified, meaning the benefits outweigh the risks. Optimization. Continuously optimize radiation practices to ensure minimal exposure while maintaining diagnostic quality. Dose reduction strategies. Use of shielding, limiting the duration of exposure and increasing the distance from the radiation source. Adhering to the ALARA principle is crucial for minimizing potential harmful effects associated with radiation exposure and is supported by regulatory standards from organizations such as the International Commission on Radiological Protection. A radiologic technologist is asked to perform an X-ray on a pregnant patient. What steps should the technologist take to ensure compliance with radiation protection standards? Answer: in this scenario, the radiologic technologist should take the following steps. Assess necessity. Evaluate whether the X-ray is essential, considering alternative imaging modalities that do not involve ionizing radiation, such as ultrasound. Shielding. If the X-ray is necessary, apply appropriate shielding techniques. Use lead aprons or shields to protect the abdomen and pelvic region of the pregnant patient. Technique optimization. Use the lowest possible exposure settings that still achieve the required image quality. This includes adjusting kilovoltage, kV, and milliampere-seconds mass appropriately. Collimation. Ensure that the X-ray beam is collimated to the area of interest to minimize unnecessary exposure to surrounding tissues. Consultation. Communicate with the patient's physician about the risks and benefits of the procedure, documenting any discussions. Monitoring. Consider using dosimeters to monitor radiation exposure levels throughout the procedure. By following these steps, the technologist can help mitigate potential risks associated with radiation exposure to the pregnant patient. What are the types of radiation shielding materials used in radiology, and how do they differ in effectiveness? Answer: radiation shielding materials are used to protect against ionizing radiation. The effectiveness of these materials depends on the type of radiation and its energy. Common types of shielding materials include lead, highly effective against X-rays and gamma rays due to its high atomic number ZIT2, which enhances its ability to absorb and scatter photons. It is commonly used in lead aprons and protective barriers. Concrete. Often used in the construction of radiology rooms, concrete provides effective shielding against gamma rays due to its density and thickness. It can be engineered to provide specific shielding levels depending on the intended use. Barium. Used in certain imaging techniques, barium can provide radiation shielding for gastrointestinal studies and is effective for specific types of X-ray protection. Steel, also used for shielding, especially in industrial radiography. Steel is effective against gamma radiation, but generally requires thicker layers compared to lead, plastic, and vinyl. These materials are often used in personal protective equipment (PPE), but are less effective compared to lead and concrete, and they may be used in combination with other materials to enhance protection. How do ICRP recommendations influence national regulations on radiation exposure limits? Answer: the International Commission on Radiological Protection (ICA) provides guidelines and recommendations that influence national regulations on radiation exposure. These recommendations are based on scientific research and the principles of radiation protection, focusing on justification, optimization, and limitation. Key points include dose limits. ICRP suggests dose limits for occupational exposure G 20 mSpire for radiation workers and public exposure 1 mSpire for the general public. These limits serve as a benchmark for national regulatory bodies. Risk assessment. ICRP evaluates the risks associated with radiation exposure, leading to recommendations that reflect a balance between the benefits of medical procedures and the potential risks of exposure. Policy development. National regulations often reference ICRP recommendations to develop and enforce standards. Education and training. ICRP emphasizes the importance of education and training for radiation workers, which influences national policies on certification and continuous education requirements. Discuss the photoelectric effect and its significance in diagnostic radiology. Answer: the photoelectric effect occurs when a photon is completely absorbed by an inner shell electron of an atom, resulting in the ejection of the electron and the creation of a vacancy in the electron shell. The significance of the photoelectric effect in diagnostic radiology includes image contrast. The photoelectric effect contributes significantly to image contrast in X-ray imaging. Tissues with higher atomic numbers, e.g., bone, absorb more photons due to the photoelectric effect, resulting in lighter areas on the radiograph, while softer tissues, e.g., muscle, allow more photons to pass, appearing darker. Energy dependence. The likelihood of the photoelectric effect occurring increases with decreasing photon energy and increasing atomic number of the absorbing material. This is crucial in selecting appropriate imaging parameters and contrast agents. Radiation dose. Understanding the photoelectric effect helps in optimizing radiation dose. By adjusting kilovolt peak (kVp) settings, radiologists can maximize the photoelectric interactions in the area of interest while minimizing unnecessary exposure to surrounding tissues. Contrast media. Radiopaque contrast agents used in procedures like fluoroscopy rely on the photoelectric effect to enhance visibility. These agents, often containing iodine, have a high atomic number, increasing the likelihood of photoelectric interactions. Explain the principles behind Compton scattering and its implications for radiation therapy. Answer: Compton scattering is an interaction between X-ray or gamma-ray photons and matter where a photon collides with a loosely bound outer shell electron, transferring part of its energy to the electron and being scattered at a different angle with reduced energy. The principles and implications of Compton scattering include energy transfer. The energy transferred to the electron depends on the angle of scattering. At larger angles, more energy is transferred, leading to more energetic secondary electrons, which can cause further ionization in tissue. Dose distribution. In radiation therapy, Compton scattering influences dose distribution within the target tissue. It contributes to the lateral spread of radiation, which must be considered when planning treatment to ensure adequate dose delivery while minimizing exposure to surrounding healthy tissue. Imaging techniques. Understanding Compton scattering helps optimize imaging techniques. For instance, in computed tomography (CT), adjustments can be made to minimize scattering effects that degrade image quality. Patient safety. Compton scattering results in secondary radiation, which must be managed during therapy. Radiation shielding and careful planning are essential to protect healthcare workers and nearby patients from unnecessary exposure. Describe the types of radiation protection equipment (PPE) used in radiology and their specific functions. Answer: personal protective equipment (PPE) in radiology is essential for safeguarding healthcare professionals and patients from unnecessary radiation exposure. Key types of PPE include lead aprons, worn by radiologic technologists, and patients. Lead aprons protect against scatter radiation during X-ray and fluoroscopy procedures. The lead thickness varies, typically ranging from 0.25 mm to 1 mm, depending on the procedure's radiation levels. Thyroid shields. These shields protect the thyroid gland from scatter radiation during procedures involving the neck or chest. They are made from lead-lined materials and are usually worn around the neck. Lead glasses. Worn during fluoroscopic procedures, lead glasses protect the eyes from scatter radiation. They help reduce the risk of cataracts and other eye-related conditions due to radiation exposure. Lead gloves. Used in procedures where the hands may be exposed to radiation, lead gloves provide protection while allowing for dexterity. They are particularly important during interventional radiology procedures. Belly shields. Specifically designed for pregnant patients, belly shields protect the fetus from radiation during imaging procedures. These shields are made from lead-lined materials. Radiation monitoring devices. While not PPE, in the traditional sense, devices like dosimeters measure exposure levels and help ensure that radiation safety protocols are followed. They are worn by radiologic technologists to monitor cumulative exposure. The use of PPE is guided by the ALARA principle, ensuring that radiation exposure is minimized for both patients and healthcare providers. Mr. Tanaka is a radiologic technologist who has been asked to perform a fluoroscopy procedure on a patient with a history of previous radiation exposure. How should Mr. Tanaka proceed to ensure patient safety and regulatory compliance? Answer: in this scenario, Mr. Tanaka should take the following steps to ensure patient safety and compliance with regulatory standards. Review patient history. Mr. Tanaka should thoroughly review the patient's medical history, focusing on previous radiation exposures, particularly the cumulative dose received from past procedures. Consult the physician. Before proceeding, Mr. Tanaka should consult with the referring physician to discuss the necessity of the fluoroscopy procedure, considering the potential risks associated with additional radiation exposure. Use the lowest possible dose. If the procedure is deemed necessary, Mr. Tanaka should utilize the lowest possible radiation dose while ensuring diagnostic quality. This includes optimizing technique settings, kVp mass, and using the lowest fluoroscopy time. Apply shielding. Utilize appropriate shielding methods, such as lead aprons and thyroid shields, to protect the patient's sensitive areas and minimize exposure. Document everything. Ensure that all aspects of the procedure, including the patient's radiation history, justification for the procedure technique used, and any shielding applied, are documented accurately in the patient's medical record. Monitor exposure. If available, use a dosimeter or other monitoring device to track the radiation dose during the procedure, ensuring it remains within safe limits. By following these steps, Mr. Tanaka can uphold patient safety and adhere to best practices in radiation protection in alignment with ICRP guidelines and national regulations. Describe the general principles of positioning in radiographic procedures and explain how they contribute to patient safety and image quality. Answer: general positioning principles involve aligning the patient's body in a way that optimizes the visibility of the area of interest while minimizing radiation exposure. Key aspects include alignment. Proper alignment of the anatomy with the imaging receptor ensures that the area of interest is clearly depicted. Stability. Using supports and positioning aids helps maintain patient stability, which is essential for reducing motion artifacts in the image. Comfort. Ensuring patient comfort is vital for cooperation during imaging, which reduces the need for repeat exposures. Patient safety considerations. Minimizing radiation exposure. The ALARA is low as reasonably achievable. Principles should be applied. This includes limiting the field of view and using protective shielding where appropriate. Ergonomics. Radiologic technologists must utilize proper body mechanics to avoid injury when positioning patients, particularly in cases requiring assistance. Compare and contrast the principles of computed tomography, CT, and magnetic resonance imaging regarding their mechanisms of imaging and the types of tissues they best visualize. Answer: computed tomography, CT. Mechanism. CT uses X-ray beams that rotate around the patient to create cross-sectional images, slices of the body. It measures the attenuation of X-rays as they pass through different tissues. Best visualization. CT is particularly effective for visualizing dense structures such as bones, as well as identifying hemorrhages, tumors, and lesions within the abdomen and chest. Magnetic resonance imaging, MRI. Mechanism. MRI employs powerful magnets and radio waves to generate images based on the magnetic properties of hydrogen atoms in the body. It produces detailed images of soft tissues. Best visualization. MRI excels at imaging soft tissues such as the brain, spinal cord, muscles, and joints, making it ideal for detecting tumors, inflammation, and other pathologies in these areas. Mr. Tanaka, a 65-year-old patient, is scheduled for a CT scan of the abdomen. He has a history of renal impairment and is concerned about the use of contrast media. What considerations should the radiologic technologist take into account regarding Mr. Tanaka's safety during the procedure? Answer: in Mr. Tanaka's case, the radiologic technologist should consider the following. Renal function assessment. Since Mr. Tanaka has renal impairment, it is crucial to assess his kidney function before administering iodinated contrast material. This can be done through serum creatinine tests or EGFR calculations. Alternative imaging options. If renal function is significantly compromised, the technologist may need to discuss alternative imaging modalities that do not require contrast, such as non-contrast CT or MRI, depending on the clinical indication. Hydration protocol. If contrast is necessary and renal function allows, ensuring adequate hydration before and after the procedure can help reduce the risk of contrast-induced nephropathy. Premedication protocol. If Mr. Tanaka has a history of contrast allergies, a premedication protocol may be necessary to mitigate the risk of an allergic reaction. Informed consent. Discussing the benefits and risks of using contrast media with Mr. Tanaka and obtaining informed consent is essential, especially given his medical history. Differentiate between ionic and non-ionic contrast agents in terms of their composition, osmolality, and implications for patient safety during imaging procedures. Answer: ionic contrast agents. Composition. Ionic contrast agents dissociate into charged particles in solution, leading to higher osmolality. Osmolality typically have higher osmolality compared to blood plasma, which can lead to discomfort and adverse reactions such as hypovolemia or renal issues. Patient safety implications. Increased risk of side effects, including allergic reactions and nephrotoxicity, particularly in vulnerable populations. Non-ionic contrast agents. Composition. Non-ionic agents do not dissociate in solution, resulting in lower osmolality. Osmolality. They have a similar or lower osmolality than blood plasma, making them safer and more tolerable for patients. Patient safety implications. Lower incidence of allergic reactions and adverse effects, making non-ionic agents the preferred choice in most clinical settings. What specific steps should a radiologic technologist follow to prepare a patient for a contrast-enhanced study? Discuss the considerations for both intravenous and oral contrast administration. Answer: preparation for a contrast-enhanced study involves the following steps. Patient history assessment. Evaluate the patient's medical history for any previous allergic reactions to contrast media, kidney function, and current medications. Informed consent. Explain the procedure, including the purpose and risks associated with contrast administration, and obtain written consent. Hydration protocol. Ensure the patient is adequately hydrated before the procedure to facilitate contrast clearance, particularly in patients with renal concerns. Medication review. Check for medications that may affect renal function or increase the risk of allergic reactions and consult with the physician if necessary. Administration techniques. Intravenous contrast. Select an appropriate vein for cannulation, ensuring the use of aseptic techniques. Prepare the contrast media according to protocol and verify the dosage based on the patient's weight and clinical indication. Oral contrast. Provide clear instructions regarding the timing and amount of oral contrast to be ingested. Monitor the patient for any signs of discomfort or allergic reactions post-ingestion. Explain how the principles of body mechanics and ergonomics apply to radiologic technologists during patient positioning, and discuss the implications for long-term health. Answer: body mechanics and ergonomics are vital for radiologic technologists as they promote proper posture. Maintaining a neutral spine while positioning patients helps reduce the risk of musculoskeletal injuries. Reduce physical strain. Utilizing assistive devices, e.g. sliders, lift sheets, minimizes the need for excessive lifting, thus lowering the risk of back injuries. Enhance efficiency. Applying ergonomic principles leads to smoother workflow and reduces fatigue, allowing technologists to work more effectively throughout their shifts. Long-term health implications. Implementing good body mechanics reduces the likelihood of chronic pain and injuries, promoting a healthier work environment and better job satisfaction. Discuss the key differences in technique and patient positioning for obtaining a KUB, kidneys, ureters, bladder, X-ray versus an upright abdominal X-ray. Answer: KUB X-ray. Technique: the patient is positioned supine on the examination table. The X-ray beam is directed perpendicular to the IR. typically at the level of the iliac crests. Purpose: the KUB X-ray is primarily used to visualize the kidneys, ureters, and bladder, providing information about potential obstructions, stones, or abnormalities in these structures. Upright abdominal X-ray technique: the patient stands or sits upright. The X-ray beam is directed horizontally, usually at the level of the iliac crests, with a focus on detecting air fluid levels and free air under the diaphragm. Purpose: the upright abdominal X-ray is crucial for evaluating conditions such as bowel obstructions or perforations, as it allows for the assessment of air accumulation in the abdominal cavity. Identify the safety considerations a radiologic technologist must keep in mind when performing an MRI scan, particularly concerning patients with implanted medical devices. Answer: safety considerations for MRI include implanted medical devices. Many implants, such as pacemakers, defibrillators, and certain orthopedic hardware, may be contraindicated for MRI due to potential heating, movement, or malfunction during the magnetic field exposure. Technologists should review the device's MRI compatibility, often indicated by the manufacturer, and consult with the referring physician regarding alternative imaging methods if necessary. Screening for metal. A thorough screening questionnaire must be conducted to identify any ferromagnetic materials in or on the patient, including surgical clips, dental work, or foreign bodies. Patient monitoring. Continuous monitoring of the patient is essential during the procedure to address any adverse reactions, particularly if they experience anxiety or claustrophobia in the MRI machine. Explain the principles of ultrasound physics and how Doppler ultrasound is utilized in assessing blood flow. What are the key advantages of using Doppler ultrasound in clinical practice? Answer: ultrasound physics principles. Ultrasound imaging relies on high-frequency sound waves emitted by a transducer that reflect off tissues to create images. The degree of reflection is based on the density and composition of the tissues. The speed of sound in soft tissues is approximately 1,540 meters, which is used to calculate distances and create images based on time delays of returning echoes. Doppler ultrasound. Doppler ultrasound measures the frequency shift of ultrasound waves reflected from moving blood cells. This shift indicates the velocity and direction of blood flow. It is particularly useful in assessing vascular conditions, such as detecting blood clots, evaluating stenosis, or monitoring fetal heart rate during pregnancy. Advantages in clinical practice. Non-invasive. Provides real-time information without exposing patients to ionizing radiation. Cost-effective. Generally more affordable compared to other imaging modalities such as CT or MRI. Versatile. Can be used in various settings, including bedside evaluations, emergency departments, and outpatient clinics. Compare the administration techniques for intravenous and oral contrast media, discussing the specific considerations that must be taken into account for each method. Answer: intravenous contrast administration technique. Administer via an IV catheter placed in a peripheral vein. The technologist must ensure the vein is patterned and the site is clean. Considerations: monitor for any signs of adverse reactions during and after administration, including allergic reactions or phlebitis at the injection site. Administer the contrast media slowly, unless a rapid bolus is indicated for specific examinations. Oral contrast administration technique. Administer by having the patient ingest a predetermined volume of contrast agent, typically €3, 9 minutes before imaging. Considerations: ensure the patient understands the instructions for ingestion, including timing and potential side effects such as nausea or abdominal discomfort. Verify that the contrast agent is adequately distributed throughout the gastrointestinal tract by timing the imaging appropriately after administration. What is the role of the fundamental forces in radiation physics, and how do these forces interact with atomic structures during radiological procedures? Answer: radiation physics is governed by 4 fundamental forces: gravitational, electromagnetic, strong nuclear, and weak nuclear forces. In the context of radiology, the electromagnetic force is particularly significant as it dictates the interactions between charged particles and electromagnetic radiation. When X-rays are produced in an X-ray tube, electrons are accelerated towards a target where they interact with the atoms of the target material. This interaction can result in the emission of X-rays through various mechanisms, including bremsstrahlung radiation and characteristic radiation. Understanding these forces is crucial for radiological technologists to minimize radiation exposure and optimize image quality. Mr. Tanaka is preparing to conduct a CT scan on a patient who has a known allergy to iodine-based contrast agents. What alternative contrast options should Mr. Tanaka consider, and what protocols should he follow to ensure patient safety? And so, in cases where a patient has an allergy to iodine-based contrast agents, Mr. Tanaka should consider using alternative contrast materials such as gadolinium-based agents, provided the patient does not have a history of allergies to these substances. Additionally, Mr. Tanaka should consider non-contrast imaging if it is appropriate for the diagnostic question at hand. To ensure patient safety, Mr. Tanaka should follow these protocols: pre-assessment. Conduct a thorough medical history assessment to confirm the patient's allergy and any previous reactions. Informed consent. Discuss the risks and benefits of using alternative contrast agents with the patient, obtaining informed consent. Monitoring. Closely monitor the patient for any adverse reactions during and after the administration of the contrast agent, adhering to institutional protocols for allergy management. Documentation. Ensure that all information regarding the allergy and the alternative agent used is documented in the patient's medical record. Describe the construction and function of X-ray tubes, emphasizing the importance of their components in the production of diagnostic images. Answer. X-ray tubes consist of several critical components, including the cathode, anode, glass envelope, and housing. The cathode contains the filament and a focusing cup, which emits electrons when heated. The anode, typically made of tungsten due to its high atomic number and melting point, serves as the target for the electrons emitted from the cathode. The function of these components is crucial for producing high-quality diagnostic images. When the filament is heated, it releases electrons that are then accelerated toward the anode by a high-voltage potential. Upon striking the anode, these electrons decelerate, producing X-rays through bremsstrahlung radiation and characteristic radiation. The design and function of the anode, rotating versus stationary, also influence the heat dissipation and overall efficiency of the X-ray production. What factors influence image quality in radiographic imaging, and how can a technologist optimize these factors during an examination? Answer. Image quality in radiographic imaging is influenced by several factors, including contrast, the difference in density between adjacent areas on the image. High contrast improves visibility of structures, while low contrast can obscure details. Resolution, the ability of an imaging system to distinguish fine details. This is affected by the spatial resolution of the imaging system and the quality of the detector. Noise, random variations in the image that can obscure details. Reducing noise improves the overall image quality. To optimize these factors, a technologist should adjust exposure factors, carefully select kVp, kilovolt peak, and milliamperes settings based on the patient's body part and composition. A higher kVp can enhance penetration and reduce patient dose, but may reduce contrast. Proper positioning. Ensure correct positioning of the patient and the anatomy of interest to minimize distortion and maximize detail. Image processing. Utilize digital image processing techniques to enhance contrast and reduce noise through algorithms designed for specific types of imaging. Explain the difference between film and digital detectors in radiography, including their advantages and disadvantages in clinical practice. Answer. Film detectors and digital detectors serve the purpose of capturing X-ray images, but they do so using different technologies. Film detectors' advantages provide high resolution and excellent dynamic range, well-established technology with predictable results. Disadvantages require chemical processing, which can lead to delays in image availability and is less environmentally friendly. Limited ability to adjust exposure after the image has been taken. Digital detectors' advantages provide immediate image availability, allowing for rapid diagnosis. It could adjust contrast and brightness after acquisition and reduce patient radiation exposure due to the ability to use low doses. Disadvantages. Initial cost of equipment can be high. Potential issues with image artifacts from detector malfunction or improper calibration. Ms. Suzuki is a radiologic technologist who is concerned about the potential radiation exposure to her patients during fluoroscopy. What measures can she implement to minimize radiation dose while maintaining image quality? Answer. To minimize radiation exposure during fluoroscopy while maintaining image quality, Ms. Suzuki can implement the following measures. Optimize fluoroscopy settings. Adjust the pulse rate and radiation dose settings according to the clinical requirements, using the lowest dose necessary for adequate imaging. Collimation. Use collimation to restrict the X-ray beam to the area of interest, thereby reducing unnecessary radiation to surrounding tissues. Time management. Minimize the duration of fluoroscopy procedures by maximizing the efficiency of the examination process and by obtaining necessary images quickly. Shielding. Employ lead aprons and thyroid collars for patients when applicable, and ensure that both the technologist and any personnel are positioned behind appropriate barriers during the procedure. Education. educate patients about the procedure and the importance of remaining still, which can help reduce the time required for the examination and consequently the radiation exposure. Discuss the importance of exposure factors such as KVP, MAR, and exposure time in radiographic imaging and how they affect the resulting image quality. Answer: exposure factors are critical in radiographic imaging as they directly influence image quality and patient dose. AVP kilovolt peak determines the energy and penetrating power of the X-rays. Higher KVP results in greater penetration, which is essential for imaging dense structures but can decrease contrast. The appropriate KVP selection is vital for balancing image quality and radiation dose. MAR milliamperes controls the number of X-rays produced. Higher increases the quantity of radiation, resulting in a darker image but can increase patient dose. It's important to adjust according to the examination type and patient size to achieve optimal image quality without unnecessary exposure. Exposure time refers to the duration of X-ray exposure. Longer exposure times can increase image darkness density but also increase the risk of motion blur if the patient moves. Using appropriate exposure times is essential for capturing clear images while minimizing dose. Balancing these factors is critical for achieving high-quality images while adhering to the ALARA as low as reasonably achievable. Principle for patient safety. What are the key components of CT scanners and how do they work together to produce high-quality cross-sectional images of the body? Answer: CT scanners consist of several key components that work in conjunction to produce detailed cross-sectional images. X-ray tube generates X-rays that are directed towards the patient. Detectors positioned opposite the X-ray tube. These detect the X-rays that pass through the body and convert them into electrical signals. Gantries, the structure that houses the X-ray tube and detectors and allows for rotation around the patient, facilitating the acquisition of multiple images from different angles. Computer system processes the electrical signals from the detectors using reconstruction algorithms to generate cross-sectional images. These components work together by the X-ray tube rotating around the patient, emitting a series of X-ray beams. As these beams pass through the body, they are attenuated by different tissues. The detectors capture the transmitted X-rays and send the data to the computer, which reconstructs the images based on the varying levels of attenuation, providing detailed cross-sectional views of internal structures. Explain the principles of image processing techniques used in digital radiography and how they contribute to enhanced image quality. Answer: image processing techniques in digital radiography are employed to enhance the quality of images by improving visibility and detail. Key principles include histogram equalization. This technique adjusts the image contrast by redistributing the pixel intensity values across the entire range of values, enhancing details in underexposed or overexposed areas. Filtering. Digital images often contain noise that can obscure important details. Filtering techniques such as Gaussian filtering or median filtering help to reduce noise and enhance the clarity of structures within the image. Image reconstruction algorithms. These algorithms, such as filter back projection or iterative reconstruction, are essential in CT imaging for converting raw data into a readable image, optimizing quality while minimizing artifacts. Post-processing adjustments. Radiologists can adjust brightness and contrast after the image has been captured, allowing for the enhancement of diagnostic details without the need for repeated exposures. What are the guidelines and regulations regarding the safe handling and disposal of radiographic materials, particularly in the context of minimizing environmental impact? Answer: radiologic technologists must adhere to guidelines and regulations for the safe handling and disposal of radiographic materials to minimize environmental impact. Key considerations include regulatory compliance. Technologists should follow the regulations set forth by governing bodies such as the Nuclear Regulatory Commission (NRC) and the Environmental Protection Agency (EPA), which provide standards for the use and disposal of radioactive materials. Proper storage. Radiographic materials should be stored in designated areas that are secure and labeled, preventing unauthorized access and ensuring safety. Disposal protocols. Used film and other radiographic materials should be disposed of according to local regulations, which may include returning them to the manufacturer or utilizing licensed hazardous waste disposal services. Recycling initiatives. Implementing recycling programs for non-radioactive materials, such as plastic and paper, helps reduce waste and environmental impact. Training and education. Regular training on the safe handling and disposal of radiographic materials is essential for ensuring compliance and promoting environmental stewardship among staff.